Hello, this is Dr. Evan Osar with Chicago Integrated Movement Specialists. Thank you so much for joining us in this webinar. We hope you have been enjoying the start of your spring. It always seems to go by so quickly, so be sure to enjoy it while it's here. And speaking of spring, this is a time of year when many of us become more active and increase our cardio exercise to start to work off those accumulated winter pounds and to look better for summer, which seems to be rapidly approaching. And of course, to keep our cardiovascular system in good shape. One thing we hear quite frequently from our clients is that some cardio exercise seems to create problems with their back or knees, and even when doing relatively low impact exercises like spinning, biking, or the elliptical trainer. At Chicago Integrated Movement Specialists, our goal is to help you take control of your health by providing you with answers to your health and fitness questions, and additionally by providing you with real solutions to your problems so that you can remain active and injury-free. As your experts in movement, we want to help you get the most out of your cardio exercise. In this edition, I would like to share with you the most common reason why you may be experiencing problems with your cardio exercise, and 3 simple things you can do to make your cardio exercise as effective for you as it should be. And if you aren't currently experiencing any problems, then use this information to remain pain-free and continue working towards accomplishing your health and fitness goals. We hope you enjoy this informative webinar, newsletter, and if you have any questions at any time regarding your current exercise program, please don't hesitate to contact us. Let's get started. What exactly is cardiovascular or aerobic exercise? Essentially, it is any exercise that increases our body's demand for oxygen. What are the benefits of cardiovascular exercise? There are so many benefits of cardiovascular exercise, but just a few of them include: it improves heart and lung function, decreases resting blood pressure and heart rate, reduces total cholesterol while increasing HDLs, the good cholesterol, improves glucose tolerance and reduces insulin resistance, reduces body fat, enhances the immune system, improves mood, and so much more. How often and how much cardiovascular exercise should we do? The American Heart Association recommends 30 minutes per day of moderate intensity aerobic activity 5 times per week, or a cumulative total of 150 minutes per week. And these are just the minimum amounts. To really achieve the health benefits from cardiovascular exercise and to dramatically change your body composition or to lose weight, you need to do quite a bit more exercise than this. And of course, you need to affect your diet as well. However, there's a downside of cardio exercise, especially if you have alignment issues, muscle imbalances, and or postural dysfunction. You see, the problem with doing cardiovascular exercise is that it is repetitive. And if you have any of these issues we just mentioned, then you will be repetitively performing your exercise and perpetuating your dysfunction. The other challenge with cardio is what happens when you get fatigued and or you begin to lose concentration. And now whatever issues you have are even further exaggerated and you start to compensate even more. So what do these compensations look like, and how do they feed into low back and knee pain? And more importantly, how do you know if they're happening to you? Let's look first at the stationary bike, a common exercise and now even more popular with spinning classes everywhere. Too often, individuals will have a loss of alignment of their core, as this friend of mine is just demonstrating. They will generally have increased flexion of their spine, and their pelvis will be tucked under and compensate by hyperextending at their neck. So they not only will get low back pain from this posture, but they will also develop tightness and trigger points in their neck and shoulders. What happens at the knees? Running is more popular than ever. There are more people running for exercise than ever before in our recent history. People love running because it is easy. You can do it anywhere, and it doesn't require a lot of equipment. And most people are under the impression that it burns a lot of calories. Unfortunately, running probably causes more problems than any other activity we do besides sitting. Look at this woman's posture and alignment on the right. And this is a very common issue we see in our running population. First, her pelvis drops, which puts a lot of pressure on her back and hip on that right side. Then her knee excessively turns in, putting increased pressure on her knee. And then her foot turns out in an attempt to better support herself on one leg, increasing the stress on her knee. So what should the pelvis and leg look like as you run? Like this African runner, notice how his pelvis remains relatively level and his lower extremity is perfectly aligned. Now look back at the female and compare. Which one looks more efficient? Which one looks like they could run for a long time? I'll bet on the man on the left. His body's better aligned and supported, so he's less likely to develop repetitive strain issues. But isn't the elliptical trainer better since there's less pounding and trauma? I'll demonstrate what I commonly see in the gym when people are using the elliptical trainer, and I won't try to correct my alignment. First, watch my back. See the wrinkles in my shirt? Those wrinkles are occurring because I am not doing a good job controlling my core. Now look down at my knees. Notice how the feet are positioned wider than my hips. Do we walk like this with our feet wider than our hips? Of course not. However, Now see what I do to compensate for this. I'll bring my knee towards the midline, putting tremendous amount of torque on my knee. While this will not hurt today or tomorrow, think of what will happen if I did this for 30 minutes a day, 3 times per week, for the next 3+ years. Do you think I would develop some back and knee issues and some sort of tightness? You bet I would. Now that we've seen what these common issues look like, let's figure out how to improve them so you can make your cardio more productive and less painful. At Chicago Integrated Movement Specialists, we have 3 principles that guide everything we do when it comes to improving movement, decreasing pain and tightness, and exercising. The first of these 3 principles is breathing. You must be able to breathe right so that you can align yourself correctly. You must breathe right so you can stabilize your spine and pelvis appropriately. And you must breathe right so you can exercise longer without having dysfunction like tightness, postural alterations, and eventually pain, which are all signs of poor breathing strategies. You want to make sure that your breath goes down into your belly as well as wide into your back so that your spine and pelvis are stabilized as you perform your cardio exercise. Lie on your back and elevate your legs on a coffee table, chair, or a ball. Perform 5 reps of 5 deep breaths. So 5 reps, 5 deep breaths, and do this twice a day. You'll notice a dramatic improvement in your energy as well as your ability to be in a good posture. The second principle is that you must center or align your body. When your body is centered, it is able to withstand repetitive activity like biking, running, and the elliptical trainer. When it is not centered, you put more stress on your joints, ligaments, and muscles, and then develop pain and tightness. To improve this alignment, when you do cardio, you must first be aware of what your posture is and your alignment is while you are not exercising. The easiest thing to do to improve your posture is to relax all your muscles and to imagine a string gently pulling you up towards the ceiling from the back of your head. Remember to create this alignment as effortlessly as possible. You don't want to have to squeeze your muscles or overcontract your muscles to achieve this posture. You want to take this imagery and posture into your cardio exercise. Now we must center your legs so you can line up your hips, knees, and feet. This will take a lot of the stress off those knees. Recall that most knee pain is associated with cardio is related to poor alignment of the hips, knees, and feet. Grab onto something stationary like a doorknob. Place your feet slightly wider than shoulder width apart. Line up your hips, knees, and feet. Don't try to over-straighten your feet unless they are excessively turned in or out. Rather, try to line up your knees and hips in the direction your feet are pointed. Now, sit back as if you're sitting into a chair. Think about relaxing your hips and maintaining the suspended feeling you had when you were thinking about the string on the back of your head. Be sure that your legs stay lined up and do about 10 repetitions. Repeat for 2 sets every day along with your breathing exercises to improve your spine, pelvis, hip, and knee alignment. And you will reduce a lot of stress in your body and feel taller, lighter, and more efficient. Now that you are breathing right and have centered your body right, now we have to move and maintain breathing and centering as we do our cardio exercise. Notice the improved alignment of my friend as he thinks about being long through his spine and keeps that image of being suspended. Now look at me on the elliptical as I focus on maintaining long spine, breathing, and appropriately I move my feet closer towards the midline. Notice there are less wrinkles in the shirt, demonstrating that by breathing correctly, I'm controlling my core better. Also look at the improved knee alignment as a result of breathing better, which helps me stabilize my core better, and by moving my feet closer to the midline, helps me align my knees with my hips and feet. And yes, I'm going slower since I really have to focus on using good form, so it is really, really hard for me. That's why it is so important to focus and bring attention to your cardio exercise. It helps keep you aligned and additionally helps you get better results with less pain and less dysfunction. Breathe, center, move. The Integrated Movement Specialist approach to improving the effectiveness of your exercise so you can exercise and live your life with greater ease and less discomfort. Remember to contact us at any time if you have any questions regarding your current exercise program or are looking for more direction on how to get started. Our Integrated Movement Specialists are here to serve you. This is Dr. Evan Osar with Chicago Integrated Movement Specialists, where our mission is to provide you with the strategies to take control of your health so that you can accomplish your health and fitness goals. Thank you. Take care.